Hello everyone, I'm Jude Parallag from BSN 1B, and today I'll perform a respiratory assessment return demonstration. So prior to the conduct of the procedure, the first thing I need to do is to gather all the equipments needed, such as stethoscope, skin marker, centimeter ruler. The second thing to do before conducting the procedure is to perform hand hygiene to protect the patient and myself from infection and cross-contamination. Good morning, sir. I'm Jude Parallag, and I'm going to be your student nurse for today. And may I see your response, sir? Please state your complete name
Very good ones.
and your birthday, please.
August 16, 2003.
Okay, thank you very much, sir. And how would you like me to call you, sir?
Jericho.
Okay, Sir Jericho. So today, I'll be doing thorax assessment or respiratory assessment, which means I need to ask you to stand up, sit down, take off your shirt, and to palpate or touch your upper extremities. Will that be alright?
Yes, sir.
Okay, sir. Do you have any question or clarifications?
Awan, sir.
Will it be alright to close the door so no one from the outside will be able to interrupt us from doing the assessment?
Of course. Yes.
Okay, sir. So, Sir Jericho, I I will just interview you for subjective data. Is that all right?
Yes, sir.
So, for the current symptom, is there any difficulty in breathing, sir?
Awan, sir.
Okay, sir. How about chest pain, sir?
Sir.
That's good. How about cough, sir?
Aan.
So, for the history, sir, is there any prior respiratory problems? How about previous thoracic surgeries here, sir? Such as bag. Wala pa. Okay, sir. How about allergies, sir? Is there any medication used for allergies?
Wala.
How about the pulmonary studies test, such as X-ray procedure or skin test?
Awan.
Okay, sir. For the family history, sir, is there any lung disease history in your family?
Awan.
It's good to hear. For the lifestyle and health problems, sir, do we use tobacco or cigarette?
Aan.
How about environmental exposure, sir? That affects our breathing sounds and patterns such as secondary smoking.
Gabi.
Last, sir, in medication for breathing, is there any prescribed by the doctor, sir? Okay, sir. So, rest assured that all the documents are completely confidential between me and the attending physician that I'll be referring you. So, let's start the assessment. So, first, I'll inspect the posterior thorax. So, sir, I'll inspect the shape and symmetry of your thorax from the posterior and lateral views. Then, compare the anteroposterior diameter to the transverse diameter. So, sir, next is to inspect your spinal alignment for deformities. So, sir, can you stand up and bend forward, sir? Bend forward. Yes, that's good. That's okay, sir. You sit down. And then next is palpate his posterior thorax. Can you feel any tenderness, sir, or pain? What about here, sir? Here, sir? Here, sir? Dito po. So, dito po. Dito po. Wala po. So next is to palpate the posterior chest for respiratory excursion. Inhale, sir. Exhale. Deep breath. Exhale. One more time, sir. Exhale. So next is I'll be palpating the chest for vocal fremitus. And I'll be using the ulnar aspects of my hand. Please say blue moon if I touch it, sir. Thank you, sir. So next is to percuss the thorax. Can you bend your head, sir? And then place your arms, hands to your shoulders, sir. Next is to percuss for the diaphragmatic excursion. So, sir, can you take a deep breath, sir? Inhale, exhale, hold, sir, hold. Exhale, sir. Can you take a normal breath, sir? Hold, sir. So I'm just going to measure it. Thank you, sir. Next is to auscultate the chest using the diaphragm of the stethoscope. Ask the client to take a slow and deep breath using his mouth. Inhale, sir. Through the mouth, sir. Inhale, exhale. So we may now move on for the anterior thorax. First is to inspect the breathing pattern and the costal angle. And then next, palpate the anterior chest. Then next is to palpate the anterior chest for respiratory excursion. Take a deep breath, sir. Again. Again, sir. Again. Thank you, sir. And then, palpate for tactile fremitus. I'm going to use the ulnar aspects of my hand. Say blue moon, sir. Blue moon. Again. Again, sir.
Blue moon.
Again, sir.
Blue moon.
Again, sir.
Blue moon.
And then, I'm going to percuss the anterior chest systematically. And now, we're going to auscultate for the auscultation of the anterior thorax using the stethoscope. First, I need to auscultate the trachea. And then, auscultate the anterior chest. So that's all for today, sir. Thank you for your cooperation. After this, you need to document findings from the client record using forms or checklists supplemented by the narrative notes when appropriate. And then, relate findings to previous assessment data if available. Report significant deviations from normal to the physician. And then, perform hand hygiene. That's all for the respiratory assessment.